first of all, the family wishes to thank the coroner for the work that she did in this very important investigation. What comes out of the report mainly is that Mrs. Echaquan's death was avoidable and that it was triggered by a combination of deficient healthcare and racist prejudices and misconceptions that led her to be labeled in a certain way and to be denied the healthcare that she needed. When Ms. Echaquan consulted at Joyce Hospital on September 26, 2020, she did so with the goal of trying to find out what was wrong about her condition related to the chronic pain that she had been experiencing for several weeks. She had consulted many times in the past and was always turned back, given some morphine, and never properly treated for what she had. And she was hoping that this would change. And unfortunately, on September 26th, she arrived in an emergency room, first of all, that was completely disorganized, but also in an environment that was tainted with prejudices that led her to quickly being labeled as someone who had a narcotics dependence and who was in a weaning process. And we now know that this information was entirely erroneous. And because of that label that she was given, she was denied the health care that was required by her condition. And this led to the events that happened on September 28th, where essentially she ended up being under the responsibility of a nursing student who never should have been there in the first place. What comes out of this is a report that is certainly a positive step in the right direction. Many steps are left. As I mentioned, we're going to file shortly a civil liability lawsuit and a complaint to the Human Rights Commission. So the battle is not over, but this is certainly a good step in the right direction.